Hello and welcome back to my channel. Today we are discussing about Cpap and Bipap. Collectively we call them NIV, non-invasive ventilation. So there is invasive ventilation when you put the patient on endotracheal tube and on ventilator, and the other is the non-invasive, which is Bipap and Cpap. So let's discuss Bipap first. You need to know what are the indications. Normally we use BiPAP in type 2 respiratory failure, especially in those patients who have chronic obstructive pulmonary lung disease, which is COPD, usually in smokers. Number two, we use that in patients who have type 2 respiratory failure with neuromuscular diseases like Duchenne's muscular dystrophy, and those patients who have some skeletal abnormalities, etc. And sometimes we use it in the weaning for tracheal intubations. These are the main indications of BiPAP, but sometimes we also use in patients like bronchiectasis who have type 2 respiratory failure. But mainly the invasive ventilation is a choice recommended in the literature, but sometimes we use it as a bridging sport to reduce the respiratory rate of the patient. Okay, so let's discuss about the Cpap. Cpap mode is usually used in patients, especially in cardiogenic asthma or left ventricular failure. Any patient who has pulmonary edema due to left ventricular failure and you're giving a lot of diuretics, but the patient is not improving, you have given the vasodilators like nitroglycerins, and still patient is not responding, then the next step would be putting the patient on Cpap. So this is one of the indications. The other indication is in a patient who has pneumonia, especially, but it's not a treatment modality, but as a sealing of treatment or bridging treatment, as I mentioned before. And one of the other indications of Cpap is obstructive sleep apnea. Those people who are obese and are unable to sleep at night, this is the best modality for them to give Cpap at night. And latestly we are using it in the COVID pneumonia, especially in the moderate disease. It is also very helpful. So let me show you how this works. I have this VentMed BiPAP device. So the first thing that you need to do is learn the settings of every machine. Remember that the mode is ST. ST mode is the BiPAP mode, and the Cpap written as Cpap. So we are in the ST mode here. As you can see, the IPAP is 14 and the EPAP is 8. IPAP is the inspiratory pressure that we have to give, and EPAP is the expiratory pressure. Normally we start with low pressures in a patient who are thin, 10 by 5, etc. But in this patient, it's an obese patient and a chronic respiratory type 2 failure. We are going with high pressures like 16 by 8. So there are other modes. As you can see, you can change the mode, ST mode to Cpap mode. These are the two modes that we use most of the time. So let's go and do Cpap. In the Cpap, the only pressure that you use is PEEP, the one pressure. So you can put it 10, 12. We usually start with 8, 10, 12, 14, maximum 16. But you can go above, but it also carries the risk of having a pneumothorax and compression of your esophagus. So let's come back to the ST mode, the BiPAP mode. So here I have put the IPAP 16 and EPAP 8, and once it's done, I would just press the power button and let's see whether it's working or not. Okay, the other thing that every BiPAP machine comes with a piping. You have to put the piping and the mask. Mask comes in two different scenarios. It's a big mask that covers the whole face. You have to put the tubing correctly and fit the mask correctly. And in this, there is another chamber for water as well. So the air that is being given with pressure are moist and does not dry your mucous membranes. And once you're done, you just have to press the power button and it'll start delivering the pressures that are needed. And you can put it during the day and mostly at night. And there is also a supplemental port for oxygen. If you need oxygen, you can also put oxygen with that. So this is how you use it. For any question, just message.